So good night, Tewksbury. It is Thursday, May 16th, 2019, and the time is 6:17 PM. I'd like to call this meeting to order. First item on the agenda tonight is approval of minutes. We have two sets of minutes, both from April 18th. The first is for our normal monthly meeting, and the second is for the special Tewksbury Cares and Tewksbury Board of Health joint meeting that we had before our April 18th Board of Health meeting. The secretary, or the clerk, and I have gone through and reviewed these, so we'll take the monthly meeting minutes first. Any review, comments, or questions?
I have nothing, Mr. Chairman.
Okay. Okay. And same with the minutes for the Tewksbury Cares and Tewksbury Board of Health joint meeting.
Nothing here.
Nope, nothing.
Okay. So seeing no comments, someone like to put forth a motion to approve both set of meeting minutes.
I'd like to make a motion to approve the set of meeting minutes and the Tewksbury Care minutes, please.
Okay.
I will second that.
Okay, so Mr. Boschetti put forth the motion. Mr. Rulo second the motion to approve the minutes of April 18th, 2019 Board of Health meeting and the April 2019 Tewksbury Cares Board of Health joint meeting. As submitted, all those in favor signify by saying aye.
Aye.
Chair votes aye as well. Motion carries unanimously 4-0. Moving on to old business. We're going to take the agenda out of order tonight. We had the grease tank regulation, which I think was more just for us to sign that. So we've taken care of that. Board of Health fee revisions continued. So I'll let you cover that.
Thank you, Mr. Chairman. So a member, Maria Zarulis, and you and myself met at the request of the rest of the board and went over all the fees for food and all the other permits that we annually take care of here between animal, piggery, body art, dumpsters, funeral directors, all types of things that we permit. We came to a agreement, I guess the word is, I don't know, a proposal that we'd like you to consider approving. It was thoughtful. It relates to what it costs us to run these programs. And of course, I underestimated, so you all went a little bit more because everything always takes more than what you think it's going to take. So I think it's been a number of years since the permits have been increased at all. So in looking at last year's, just as an estimate to let you know, we don't make money. It's not our job to make money as the health department. However, when we do offer a service, we try to offset what costs the town for our work. So for example, the permitting totals would be, let me see, hold on 1 second. So food permit totals would end up in the totals of all of them will be 17,000 more from last year's. We also had a problem that a number of permits were, we don't permit them anymore, certain food categories by the new food code. So it's not a huge percentage, but I think it reflects the effort that we put into permitting them. So I don't know if there's discussion. We did have one that we didn't discuss, which is permit late fees, which is on the bottom of something we had talked about before. Basically, permits are due a certain date to be renewed, and if someone doesn't renew before then, on that time, in the past, it said that if the fee would increase ×1 each day. So if it was $185, you miss one day, it'd be another $185, the next day would be another $185. So much so, you know, we go to great pains to try not to have people late because of that. But then also, it just puts a lot of pressure on the secretary, and we don't know if it's the fair way to do it, because doing the permits don't cost more because you happen to be duelist versus somebody else, so I wanted to know if you could discuss that prior to making any other
And let me just add
suggestions.
2 things to it, and probably because we're being taped for just benefit of anyone that will watch this meeting afterwards. The permit fee calculations were a laborious effort on your part, no pun intended, to try to estimate the actual number of hours by different staff people in the department that would normally be involved to process the permit, the new fee, or the permit or the reapplication, or the renewal. And since with the GI system on board, and we're having to bump up the cost for the GIS piece for each permit. When we look at all that, the numbers were sort of across the board. And just felt it was gonna be a simpler and cleaner thing to try to have fewer price points on the fee structure, but to also look at those fees that would be paid by a resident as opposed to a business. So on the permit fees, there were a couple that would really, whatever's listed there is $50. So the temporary food permit, the animal permit, beaver dam breaching / trapping, those are at 50, realizing that's a resident that would be having to foot the cost of that. So we felt it was more worth it to lower the permit fee slightly on a residential type permit, but to make sure that we more properly and fairly charged the permit holder a fee based on the level of effort the department goes into in reviewing and approving a permit. So that's why the numbers look a little higher than what we had seen last time. And then coming into the late fee, one of my thoughts was we'd simply just say the permit fee doubled if the applicant is late in getting the permit submitted as opposed to a daily penalty. Because I think the daily we've only had one occurrence of that, and that was last year from an auto parts store, if you remember. And
Yeah,
for the food permit, and I think they did wind up paying it just so they could sell candy bars.
And now they don't need a permit
Right.
with the new food code, so.
So we're not trying to really penalize people financially, but rather just make sure that, encourage people, get the permit renewals done on time. The other thing we have listed here on the $50 is annual inspection. And at our meeting on Monday, we had sort of gone over the process of inspections, and Susan was walking us through, if they do a food permit inspection, there's a violation, then she goes back to make sure that things have been rectified. And a lot of times, she'll go back, and when she was told to be able to come back, because things would be fixed by then, and she'd come back and things weren't fixed, so they're partially done, so she'd have to go back more than once. So we thought that it was a good idea to come up with an additional inspection for a violation, because every time that they have to go out and inspect, that's hours of labor that, from the health department, that have to go back there. And especially if it's a case where they were not ready for that reinspection and they never called the department and say, don't come today, we're not ready yet. There's a lot of wasted effort in the department's time. So we're trying to come up with some way to get the permit holders to be aware that only call to have a reinspection when you're ready for that reinspection. Just like you wouldn't call the building department, have them come out and have final inspection if you're not ready for the final inspection. So we're trying to get people looking in that type of a mode. We'd also looked at, for those people that seem to be repeat violators, so if you go back on the food code, for the second inspection a given year, and if you find the same violations that were being noted in the first, and there, we talked about being the priority violation, so everything that's now on the first page of the 3-page inspection form would then potentially drive an automatic surcharge for the fine, just like with auto insurance. That if you get into an accident, you have a surcharge applied. And to get, especially the food permit holders, aware that they're all in charge of this. They should be keeping their places clean and safe and not having to keep going through and finding repeat violations, in some cases from year to year. And just trying to find some way to put some teeth in this so that they start taking this seriously.
Close them down.
They do. They
Well,
just
Close
did.
It's-
them down.
It's,
That's.
So there's a lot of things that we look at, so it wasn't just the,
right. So what I requested is that now that we have the new food code coming, we need to educate people on the new way things are being done. This is called active managerial control. It's a phrase they don't even know. And they have to get to know it. I mean, you know, this is in their court. We're not really supposed to go and write down all the things, you know, that are wrong and teach them how to do stuff. We've always done it that way. We walk in, we say, let's check your, sanitizer bucket. Oh, it's off? Come, let's teach you how to do that. Now, we'll still do that, but it needs to be, that needs to not happen next time. So there's gonna be a transition over this period. So what I've asked, because I'm not looking to create a chaotic time, because every time we find them, it creates paperwork for my office. It makes them come down, and it also creates chaos, and that needs to be a gradual thing. So I've asked that, and they both seem to go for that we work our way into that. I know it sounds, it's just how it's always been done. You can't just change something tomorrow. You have to tell people it's coming.
Do we have a basic criteria? I mean, as you kind of know my approach on things. If you're a kid getting your license, you know what you have to do. If you're gonna go into a business, you should know what you have to do, and they should I think that's part of what we're trying to do, is streamline everything here in this, to make it easier for the people in the community, in the interest of protecting public health, and also to make it very cookbook and textbook-like. So, is there something that we can put together? I do understand the transition time, but my tolerance for things that I don't like to see wasted energy, and I see how hard everyone works to put this together. So we're not dealing with little kids, so I don't have a problem if there's a phase-in period, but with these new rules, I mean, when someone goes in business, I think it's up to the person to know. Ignorance of the law is no excuse. I know if I do something that is wrong, and even though I don't know it in my business or in anything, I am still held accountable. And I believe that if someone has a business, if you don't know what you're doing, you better find out. And if you're doing something that can jeopardize the public safety or the public health of the community, and all I can really care about is our community. I go into other communities and I see things when I go, I just can't help it. And, but my concern is, will we have those guidelines readily available for those people to see, so that it's,
The new food code
Yeah.
is built that way. The first, you
So I
have to
thought-
literally, everything is listed and you check it off, so it's clear. These 29 items are the priorities. And then we have to retrain ourselves. We used to go
Sure.
back and look at every little, fix a piece of tile. we're not supposed to go back anymore. It's gonna be very difficult for us to change how we do things, because unless it's one of those, we're supposed to let it go. It's really hard to, and say, okay, we'll come back and we'll see if it's fixed at our next 6 months inspection. So we're teaching ourselves as well. So it would be easier for us to say, like, I did one this week, and they actually had all 29, and I said, letting you know, you can do this. Because most people are like, I can't meet your standard, you guys are too high. No, this is a standard you can meet. And then we're not gonna nickel and dime you on the other end, so then they'll see that there's something for what, and we're not gonna walk in and go, oh, the light bulb's out, $65 to you. That's not the plan, it's the other way. So that's what we wanna communicate that, but they don't know, they don't, they're just doing this. They just cook and they don't know, and that's just the food, of course. But in anything, everything that we've always been taught is you go, you inspect, you find something not accurate, you write it down, you come back and do it. There's never been charges for it, there's never been, that's just how it is. It's not OSHA, OSHA comes out and finds you, boom. You have that on the right side instead of the left, boom, you're fine. That's OSHA, that's not local. So,
And workplace safety is only, workplace safety is only dealing for the employees. We're dealing with the public safety and the public health of the community. So there's two different things. You can be doing something wrong that OSHA doesn't technically care about, so, yeah, so like.
they're true, so we need to learn a little bit from their book, and, but still, we obviously are working for the town, so.
Can we get a copy of the, I know that I knew the changes were coming, I know
The
personally,
checklist,
the checklist, I know I'm gonna be taking the whole new Serve Safe course myself. I wanna just make sure that I
I
can.
thought I gave, but yeah, I'll send it, I thought I gave you one, maybe that was you guys, so.
Yeah, I think it was just us.
Yeah, that's right.
Yeah, I know I didn't get one.
No, that was for the meeting, that was, yeah.
When's the phase in for the 2019 year right now?
Well, the 2013 code has already been accepted. It's in place. Every town is just doing it as they go. We haven't, because it's just, they just dropped it on us in October. We literally just got our new check sheets 2 weeks ago. So now we're learning how to inspect properly. So we're being trained, and every time we go out, we're learning and we're training them. So it'll be this year.
Yeah, I mean, I can't see it would take longer than the phase in by 2020.
Yeah, no, they all need to know.
I mean, it should really be effective, I would think, fiscal year
It's
July
already,
1st.
yeah, it's already effective, but
Yes.
if I walk in and they don't have their vomit kit, I don't wake them up, I tell them what a vomit kit is.
Well, they can make it up, I'll give you, I mean, we make, I can give you a little thing that you can hand out to people, I'm happy to share it. I have these inexpensive things that I put together in what I do for people, so.
Yeah.
It's simple and it follows the guidelines and it's not very expensive, you can buy them, but you can make one up
You
and,
totally can make it up,
I mean,
yeah.
I'll give you, I'll get that for you, so you can hand them out.
And with the new food code, we can also, any customer can go in and ask to see a copy of the inspection.
You know what,
They could, go ahead.
we're in a very rapidly communicating times right now, so people can either hear about it on Facebook, Twitter, Instagram, or if they're not that tech savvy, they can go in and see it, you know, at the facility or food establishment. You're gonna see it anyway. People have to, the people are very aware of what's going on. I know what happens in our business, and I'm in healthcare, and I hear the questions and I see what goes on, so, and I know it does happen in the food establishments and other businesses, so, yeah, I think it's good. I think it'll keep everyone on their toes, because people have to self-police themselves. Just because you don't get away with it doesn't mean it's not
Alright,
happening.
So 2 times the permit fee. And then when we're ready to do surcharge, we can add that
Yeah.
for the future.
But I think part of it is that we can at least make mention of it,
Sure.
because I was, as mentioning, I'd rather we at least had the framework for it so that we, especially in the food permits, we put the permit holders on notice that this is gonna be upcoming, so there's even more reason to make, for them to,
And the more visits you go
Comply.
to a certain maximum, maybe 3, I mean, it's like baseball. Baseball's really good. 3 strikes and you're out. If you haven't figured it out by that time, I mean, like I said, I don't feel we're dealing with 2-year-olds and 3-year-olds. So if people haven't got it by that time, then it may impact what their business is.
Yes.
Because I know many businesses, I know in my business, you only get 1 chance. And you don't even get the first chance. If you're wrong, you're wrong. Thank you. So you can't afford to not be right. Failure's not an option, right?
So, Mr. Rue, any comments or feedback?
Negative?
It won't be the last time we talk about it, no doubt.
No.
So
Well, I
it's-
always
it just
bring-
gets us to the next phase.
I
Well-
always bring back, I had happened to drive by Kitty's the other day. And I just noticed from being very familiar with the facility over the years, that it just seems that their parking lot is not as full as I remember it being many years. And sadly, even if they've done everything right, there's a little bit of penance. And all I know is I never want to be on our watch when something like that happens. So it's like, and
It's not,
there's extenuating circumstances to that, as we all know, so.
we want to be on the right side with that.
Right, exactly.
So since part of the driver for looking at this now is as they're trying to complete getting the GIS set for the department, have you been given a date on when you need to provide the new permit fees?
3 months ago.
Okay,
So, yeah, he's at the point that he needs to put the formulas in, either that or he's gonna leave them blank and we're gonna have to type them all in.
When's the town's
So-
fiscal year, July 1st?
Yes, I'm trying to spend my money now, because this has been going on for over a year now. This.
Is it
this
possible, is it
GIS
doable to do
immediate.
by the end of June? I'll have it all done, so,
He needs these to get to the next level, so.
who's he?
The People GIS, it's
Okay.
not a person, but People GIS in
Okay,
general. They're at the
sorry.
next stage, they're waiting for us, so,
so would you look for us to try to
I'm
approve this
looking-
tonight?
yeah.
Then I'll wait for that until we have Member Scarano here.
You know, then you're gonna redo it again? Oh, no.
No, well,
Wow.
I'll see where he is.
Hi, Dave.
Good evening.
Evening, David.
Late arrival.
Representative.
You're a busy guy, good
I
traffic.
figured, yeah, that's exactly what it was. I figured you were fashionably late.
Yeah, we have to
We
get-
jumped ahead a little bit and chatted, but
Please.
we were moving back.
Finishing up some bad.
Okay, you figured an hour is good enough out of town, but apparently not. So. We got the music to pass the time.
It's unbelievable. Yeah, we never had music before.
and we're not live tonight, it's being recorded, which will then be up in,
And you'll have
Facebook.
to share that microphone. We only have the 7.
Absolutely.
well,
Just go with that.
yeah, we'll just, so, may as well let's put it for a vote now, just so we can keep the meeting moving.
Can always change it later.
Yep,
It's just a place
like
to
a town meeting,
Yeah, yeah. Well, we're
Not
not
at
that
town
tough.
meeting,
We're
but-
not that tough.
yeah,
You know, it doesn't take that hard to change something.
right. So, I entertain motion to, someone put forth to approve the updated permit fee list as submitted.
I'd like to make a motion to put the updated permit fee pricing, please.
Okay, I'm willing to second the motion?
I will second.
Okay. So the motion's been put forth and seconded to approve the updated fee schedule as submitted tonight. All those in favor signify by saying aye.
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 Chair votes aye as well. Motion carries unanimously 4-0. Okay. Thank you all very much. And thank you, Maria, for joining us on Monday to have a lively discussion about the permit fees.
Anytime.
We actually do talk about health things too.
Yes, we do.
Okay.
Trying to get the business.
So we've completed old business. We're going to move on to new business now. So on the new business, we have Tewksbury High School students will present their thoughts on how the environment and addiction coexist, followed by a frank discussion on addiction with State Representative David Robertson, our guest tonight, and Board of Health members. Okay?
So hi, everyone. Thank you for coming. I appreciate it.
So you have to be, if you want to be heard, I guess you'll have to be talking into one of these.
So I'm Maria Ruggiero. I am the Substance Abuse Prevention Coordinator for the town of Tewksbury. I work on collaboration with 7 surrounding communities as well. I am very proud to have a group of students today that have really impressed me. So I will turn the mic over and they will go from there. Thanks for joining us today.
So since this is a public meeting, we'll treat you like any other person becoming before. So if each of you could state your name and your address, and I believe I saw all of you sign on the sign-in sheet as well? Okay.
My name is Lily Giganti, and I am here in Tewksbury. And I'd just like to say thank you for giving me this opportunity to talk in front of all of you today. And should I let them say their names
Yeah,
first?
we'll have everyone introduce and
My name is Anisha Lacerda, and I also want to say thank you for letting us be here today.
My name is Lindsay Pettingill, and I'd also like to thank you all for this opportunity.
I see a trend here.
Yeah, I'm really thankful.
My name is Juliana Ricky, and guess what? I'm also thankful for giving us this opportunity.
All right. What we're here to talk about today. The problem isn't that we don't know the facts about underage drinking. According to CDC.gov, excessive drinking is responsible for more than 4,300 deaths among underage youth each year. The problem is that way too many of us students have accepted it. They feel sad, depressed even, looking for a way to cope. I mean, hey, alcohol will numb that, right? Excessive drinking is responsible for more than 4,000 deaths among underage youth each year. They look to their friends, parents, siblings, and peers all hating high school and going to alcohol. No one thinks it will happen to them. Well, what I have to say is this. Our society, our schools have normalized struggling with alcohol. And when I say struggling, I mean that people look at it as a way to cope instead of a substance that shouldn't be used. People are numbed by each experience they hear to the point where they don't see themselves going down the same path as the stories they hear. This is not a lack of knowledge, we know. This is a lack of will. They don't need tough love, they need the truth. People are waiting for someone to look them in the eyes and say, "It's not normal to struggle. You won't get out of this until you accept that. You don't live to struggle." But now I have a question for all of you. Who's going to tell them?
We need to tell kids and teens that the consumption of alcohol and drugs is not a rite of passage. Drinking alcohol will not make them any cooler. Children and teens seldom see this point. In fact, children and teens often feel pressured to use and abuse drugs and alcohol because it has become popular and normal. This is unacceptable. No one should feel as if they have to harm their bodies in order to fit in. In order to fix this problem, we need to start talking about the risks of underage drinking and drug abuse at a younger age. If kids are more educated about drug and alcohol consumption before middle school, they will be less likely to want to try and abuse these substances when they are older. We cannot overlook the opportunity to stop addiction before it starts. Oftentimes, kids and teens will turn to alcohol and drugs to help deal with their problems and stress rather than turning to an adult for help. This may be because children and teenagers feel as though it is normal to struggle, as Lily has stated, on their own and abuse substances to cope. They do not understand how much more harm is being done to them this way. Struggling should not be popularized. Kids and teens should know that it is not normal or acceptable to turn to drugs or alcohol in times of conflict. The proper way to deal with this stress is to talk to a guidance counselor to seek help. Most students in elementary school do not even know where their guidance office is and are too scared to ask. By simply reminding young students that they are always welcome at the guidance office, several cases of future addiction and abuse of drugs and alcohol can be prevented.
It is important to start teaching kids about serious consequences of substance abuse at a younger age. The younger the kids are, the more likely addiction is to occur. When they see people drinking from friends or from TV, they're most likely to turn to that because they see people being happy and they see how it fixes their problems in the moment. But really, it's like when you put concealer over a pimple. The pimple's not there for a moment, but then when you take all the makeup off, you see more pimples starting to form. It helps in the moment, but in the long run, it's just doing you more harm.
The media that is aimed at children and teenagers shows that drinking and using substances is considered cool. But I believe that we need to change the way that media is aimed at us and the way that adults speak to kids. If we show people that you can be successful and cool without using and abusing substances, then hopefully it'll be able to change the narrative and really solidify the fact in their brain that they do not need to do it and they can say no. I think that's it.
And what I'd like to add is when I wrote the strategic plan for the communities, we talked a lot about mental health and how it and the environment and families and everybody around them affects the substance abuse. I did not tell these girls that that was one of my strategies, that mental health and substance abuse was so tightly wound. They came up with this on their own. So I appreciate you taking the time to start a conversation, and with any luck, we'll be able to find something that was going to make a solution.
So I'd just like to start the board comments by saying first, thank you very much for being willing to step forward and share your thoughts, because it's not always easy talking about something that goes against the current train of thought. So I really appreciate your efforts in that. And as equally impressed about is the fact that you're willing to come before us. I know this will be up on YouTube, and talk to an elected official about this. Being on the Board of Health, one of our mandated roles is to improve the health of the public, of the residents. And we know these issues are occurring, and we work tirelessly with Maria Ruggiero, with Tewksbury Cares, and it seems like, in some cases, we're not making a dent in the issue. And in every October, when it's National Substance Abuse and Prevention Week, and we run all these different offerings in the town, even at the high school, it's like crickets. No one comes out. Parents don't come out, and well, now my sons are graduating high school. I'm no longer a high schooler parent, but speaking from experience, it's like you don't want to be seen at one of these events because people are going to think, oh, someone in your family has an issue. And you're very correct that you can't be hiding behind things. You need to be able to come out and address them. And on the Tewksbury Cares side, we've really been struggling with trying to get Tewksbury Cares re-energized, and there have been discussions about this is an opportunity that we can use that group to help education process and connect dots between different resources. And with David Robertson here tonight, I pose a question to you. It's a two-sided or two-part. What are you looking from the board and from Dave Robertson? And then in general, what suggestions do you have? Because one of the important things for the board is that we need to be able to hear from members of the community, those that are directly impacted or not, about different health and well-being issues, because we only know what's in our circles. And we really need to know really what's happening in town if we were really able to best do our job. So for that, I thank you very much for stepping forward. So I'll let you come up with, how would you like to answer that question? And there is no wrong answer.
All right. Yes.
And I don't know is allowed as well.
Yes. So I actually have an idea. When I think of this, the problem, people don't want to show up, like you said. The way to target this is, right now there's a lot of trends going around where they have this thing, it's a PSA actually, then it says share this on your story if you support this message on Instagram. And WWF, it's a environmentalist group, they even did this with Save the Elephants, and it reached over 3.3 million people. Of course, I don't think it'll go that big, but it is a start. So if we create a PSA, maybe an Instagram or something, and we start putting that PSA online, then maybe even getting some money to advertise it and get it on people's feeds, people will see the message, and it doesn't take anyone just going to an event. They can hide behind their screens, which I know isn't good, but sometimes that's what helps people just learn.
Something that I would like to add, I'm not even sure if it's possible, but I feel like a lot of kids who are struggling with like drugs and addiction and things like that, they're afraid to come forward and get help because they're afraid they'll get in trouble. Is there any way that we'd be able to say, we just want to help you, there won't be consequences like at the moment? Like to push, we just want to help first and you won't get in trouble. But like, I don't know if that's possible in any way.
May I address that?
Oh, go right ahead.
So are you speaking with regards to, say, if someone was to come forward and says, I have a substance abuse use disorder, and avoiding civil or criminal charges?
Yes.
So actually, our DA, Marion Ryan, proposed that, specifically looking towards his model in legislation. You're all going to be in school in a few years. When it came to alcohol overdoses. And they found out that kids were passing away because they didn't receive help in time because friends were afraid to pick up the phone and call 911. They roll them on the side to give them the cold bath, which resulted in tragedy a few years ago. And the DA said, well, we're not going to prosecute on this. Saving that life is more important than seeking criminal charges. And then after we have stabilized that person, we get them to a welcoming environment. Let's talk about the underlying issue of addiction.
Yeah.
Right? And actually, she's proposed legislation to expand that to include, in case that, again, you'll be in school in a few years, you come across someone, maybe it's opioids, maybe it's something polysubstance, and they've overdosed, so you don't hesitate. You call and get that person help. So it should be very shortly. I imagine that legislation will go through and will provide an immunity not for the people dealing, not for the people selling, but just for the end user who met a tragic fate, and if we can divert them and get them the help they need to return them back to normalcy.
Cool.
So you're ahead of the curve on that.
Cool, thanks.
And you might want to look into, the courts all have diversion programs. So in their intake process, they have diversion programs away from criminal liability, probation, and into treatment. So the diversion programs are something that people should be aware of and not be afraid to come forward for fact or for fear of prosecution when state representatives and DAs are relying heavily on these diversion programs, because it's gone a long way from criminal treatment to treatment for the underlying condition.
Okay.
So they should not be afraid to come forward, especially first-time people that are finding themselves struggling. The diversion programs are many, and the support from the legislature and the support from the DA's office is great.
Cool. So we could say that now without being like, this isn't true, or
You
do
would
we have
be
to wait a minute?
surprised if you even spoke to someone at the district court level, which is a good place to reach out, because people who are impacted here end up in Lowell, Woburn. These are district courts that all have these type of diversionary programs. The more they talk about them, the more they will be utilized.
Okay.
All right?
All right, thanks.
And just so you're not aware, he is our lawyer on the board, too.
Oh, cool.
So a little bit of experience there.
All right, thank you.
If I can add one more thing?
Yeah, go ahead.
There's a reason that governor, oh, all right, that's true, speaking to the mic. It's a small room, usually I can just speak. For all the people there on YouTube. There's a reason that the governor and the DA have been invited to talk about these programs, and as actually Sheriff Katusian as well. It was quite of a wake-up moment when we realized our Department of Corrections was the largest supplier of withdrawal health care in the state, right? You think it should be a hospital, it should be nurses, it should be sober homes and halfway homes, which are trained, but actually, no, it was our prison system which gave it quite a lot of pause. So, Mr. Scarano, who, and I want to say most of the genesis of these ideas actually came from your local boards, which during the local elections, I always say it's a shame. People should be paying attention. These folks are up here not for fame or fortune, but because they have ideas. And they'll speak up the levels to folks in my position, or Senator Feingold, for example, and the sheriff and all that. So a lot of the folks sitting here or their counterparts in other towns are the ones that said, hey, I've had a personal experience. I had a son, a daughter, a niece, and nephew who went through this. And these ideas have been very successful. One of the ones perhaps best at doing so, and it's something Ms. Ruggiero spoke to, is that there's this history of self-treatment going on out there, especially around mental health. People either viewed drug abuse strictly as a criminal issue, or people were, on a more personal note, too ashamed to go forward and seek counseling or whatever other mental struggles they might have. So instead they turned to buying a prescription pill off of a friend, Ritalin or an opioid or something harder, and that eventually led them down a path. And the interesting thing about the state, and you'll hear me speak about it in a little bit, is that similar to previous public health crises we had seen, the opioid addiction was completely atypical in the fact that it followed no ethnic or socioeconomic status that other diseases typically do. Usually there's a geographical component. In this case, opioids they hopped city bounds. It was as prevalent as it was in Lawrence, as it was in Andover, and those are perhaps two of the most different average incomes in the state in terms of education, in terms of household income and everything. So that being said, like we said, we're heavily looking at diversion instead of a criminal issue. We're looking at it as a public health issue. Again, thanks to folks like we're here with tonight who put forward this idea. Thanks to folks like you who said, wait a second, I know my friend has this issue. I don't want to see them suffer. They're not a criminal. Perhaps they're in a dark place in life. Perhaps their home life's a bit out of balance and atypical, and that's what caused them to lean on it. So I just wanted to, again, highlight that, and you'll see those points teased out a little bit more later on.
All right, thank you.
And can I add something, please? We know that the opiates is probably one of the hugest problems we have in all of our communities, but I don't want to lose sight of the fact that, especially when teens are drinking and they're too young to understand the consequences, it's so much easier to say, yes, I'll take one of those pills because I've had a couple of drinks, and they're not really reasoning through that this is what they're talking about they don't want to do. So I just want to make sure that underage drinking and the alcohol stays in there as well, so that we cover the full gamut of concerns, not just the end results, if that makes sense.
Yeah, no, definitely, we're trying to look at both from the substance abuse, the alcohol, the mental health issue, because so often they're all intertwined. And I think another part of the issue too, and I'll pose this for another question for you. I'll make my questions harder as they go on. I know that there are a lot of challenges in communication between your generation and your parents, which also does not help this issue. I think it actually makes it worse, because a lot of, and speaking from first-hand experience, kids don't always know how to go to their parents, or in some cases, their parents may actually be worse offenders than the children. And so you can't really go to them for advice. So they're stuck. So from your knowledge of the issues you're coming before us tonight, and we've been challenged in trying to get parents to come to events to be trained, how much of this issue do you think is something that involves parents that we need to find some way to provide assistance to them, whether education or other?
Yeah, sure.
Well, I think this is definitely something that, no, I wouldn't say the parents' fault, but they also play into this, which is why we should bring it up. And what I'm thinking is that we do need to get the parents involved, because that's how everyone learns, from their parents. And even though it might not be in person, just like something online, even just get out the information to them, because people most likely won't show up. And like I said earlier, social media is targeted more towards people our age, so that wouldn't work. But even still, they use something online, maybe even an email list, which doesn't sound the best, but it's a way to get information out, and people don't like to show their faces, especially with subjects like this, unfortunately. Anyone else?
So another example of this is, it's probably no surprise to you, vaping has become almost an epidemic now. And my take on it is that a lot of parents either dismiss the health issues related with vaping, probably because you can also, a lot of these things, you can use them as a smoking cessation tool. So there is a positive side, but there's also a negative side. And the negative, I think in this case, far outweighs the positive. But it sounds, from my understanding, and talking with others, I think some of your challenges are that parents may not be aware of the issues. Or they may have done it when they were your age. They're like, oh, it's just a rite of passage. Why is it an issue now? Well, I think there are a lot more issues that are facing kids now, especially with advent of social media. Things now spread like wildfire. So we're struggling to try to figure out what can we do. And I know at the government level they're trying to do that, and I'm really focused on what can we do in this community. So for that, we're going to be continuing to look for your help. And one thing that I'll mention tonight, which we had, Director and I had talked about ourselves, is as we are looking at trying to get Tewksbury Cares really up and running again fully, we need to make sure that we have members, including board members, that represent all the different constituent areas in the town. So one of the places that I think we need to have representation on Tewksbury Cares is from the high school population. So I'm not asking anyone to step forward tonight and nominate, but we're really trying to make sure that we include people that have a passion and knowledge of what's happening and are not afraid to speak up. Because if everyone knows what's happening and no one wants to come forward, that's not going to help any of us. So that's why I really, truly appreciate that you folks wanted to come before us and also make a pitch to David as well.
I have a follow-up question, Mr. Chair.
Yeah.
Is that right? So one of the things that the state and the local boards have similar situation as Mr. Barry was explaining is the approach, right? So sometimes there's a generational gap or uncomfortable conversations, right? We joke about it, you see it on TV and what have you, and they make jokes, and this is serious because it's frankly, it's killing people. Now, when we were brainstorming and speaking in the past about such events, do you think it'd be better to have separate events targeting different demographics? So for example, quite often at the senior center, we have conversations about how they dispose of their medication and how to look for signs in case their friend or a family member is stealing from them and what have you. Now, obviously, that's not the lessons that you need to know. And it's not the lessons that you four need to know, but some of your peers might. Do you think we'd have success in making it more family-oriented, or would it be more successful to say we have an independent event more geared towards the parents and then something more geared towards your colleagues?
Does any of you want to say anything?
I can go first.
Okay. So I think the way we do that, if we had it family oriented, like we do social hosting nights, I think that a lot of times parents would maybe rush off and say, oh, we don't really need to go to that. So I think if we did it as a demographic, as the high schoolers, and because we know what a lot of them is, and then if we educated parents, because I'm pretty sure if I walked up to my parents one day and I was talked about a jewel, they wouldn't have no idea what I was talking about. Okay. So I think that there's definitely the generational gap, and that there's different ways that everyone could learn different things from it. So.
Thank you for your insight. Anyone else?
I only have one comment, just quickly on that.
Yeah.
Seeing you people here, it's a generational change, okay? The torch has been passed to you. You recognize at your level what the problems are out there with your peers. We're in a different peer group. You may or may not be able to reach us as parents, as contemporaries, as board members, but we seen a generation lose a little bit of something. And it's hard to get them back. It's hard to get them changed. You heard that old saying, it's hard to teach a dog new tricks. It just doesn't happen. But the torch is passed to you guys. You sitting here tonight, pick up that torch. You deal with your peers. You get them to meet you at your level, because they're more likely to listen to you at this point than they are to take constructive criticism from their parents or contemporaries of their parents. And I think you guys, once you realize that you are the people that have the responsibility and accountability, and you've stepped up the plate to take that, while a lot of other people, a lot of other generations, just simply aren't going to pick up the torch. So I hate to put the burden on you, but it's your generation. It's the people that you are going to be with, marrying, working with. This is the shot or the opportunity that you have. And it's so important that you deal with those peers on that level, and hopefully you can get the other generations to pitch in and help. Maybe even stop some of the habits that they have that are bad health habits. But pointing those out, that, even, to say my parent has a bad health habit, that isn't, denigrating the parent or throwing them under the bus. It's identifying something that maybe you don't want to do when you get to that age or you get to that point. So I think the torch has been passed to you guys. Just sitting here, it's great to see that you have the ability to step up to the plate and take some accountability and responsibility, and we applaud you for that.
Thank you.
Yeah.
Could I say something? I just want to tell you that I think you really hit the nail on the head when you said, kids are, they're unable to cope with whatever's going on. They don't have anywhere to go, but they're bombarded by these images, whether it be on TV or in the movies or even in their own home, that, oh, I'll just have a drink and it'll make it better. I mean, you go to Marshall's, all you see are signs and all these things that are targeted towards women that says, oh, it's all about wine and wine this and wine that, I'm gonna have wine, and it's this constant thing. And wine will not make, anything better when you're 14, 15, 16, or even when you're an adult. There's a difference between responsible drinking, whether it's, at a social event or in your home, and drinking to cope with a situation. And I think that young people are seeing it so frequently that this is causing, this problem to exacerbate than it has been in other years. And I think it's great that you are aware of that. I'm curious to hear about, your friends and other students. Are they expressing the same thing, that this is what you do to cope with your daily stress, is I'm just going to drink? Is this something that they're growing up seeing every single day in their home, and that's causing this problem? I'm just curious, is this something that you're hearing from your peers?
In a sense, yes. And what I have experienced is that people are sitting there waiting for someone to go up to their faces and say, this is not okay and you need help. Mm-hmm. And I've even messaged people just being like, I don't know what you're saying right now, please explain. Then they'll go on and they'll go on and on and on and on and just talk about what they've been dealing with. People are waiting to be heard. We just need to give them that outlet.
Mm-hmm. That's great.
I have one last question for you.
Can I add
Oh, go ahead.
When I did the original assessment, I worked with people who are in recovery for various substances. And I'd ask them, okay, so now you're in recovery, you've gone through all the steps that you need to kind of be whole again. Can you think back, why did you start? And they pretty much said, it was some type of trauma when they were younger for the most part. And then when I spoke with teenagers, and I had teenagers in focus groups, they said the exact same thing. The difference was the language. The adults would say, I was anxious, I was depressed, I had trauma as a young girl. And the kids were saying, oh, people are just nervous all the time, or we have too many tests. It was the exact same thing, just different language. So, and that was a couple of years ago. So I just wanted to kind of throw that in as well.
So my question is more for you four as well as you, Maria. It seems like one of the themes tonight has been a lot of the substance abuse and alcohol abuse, I guess we sort of phrased as self-coping skills. And obviously, one needs to have proper and safe coping skills, but it needs to be more than just coping skills. It also has to be the ability to communicate with someone open and honestly, whether it is a parent or a school guidance counselor or someone else that you trust, to provide you good recommendations. So, what's being done at the high school level to provide sort of that proper coping skill awareness and options, what some proper coping skills are, and anything that works with communications? I know you were talking about for the middle schools and younger, they may not know who their guidance counselor is, so they're missing out on that, and they may not feel comfortable going to the parents. So is an opportunity there that help could be provided at one level or another if you see that that is a need?
I definitely think that at the high school, our teachers are really supportive, and like they say, you know, we can do this and we can help you and we can do this, and we see our guidance counselor a lot and we know a lot about that stuff. But like you said before, that the little kids, they don't know that stuff. So if we really did something with this, then we could possibly set up, and maybe they don't even know that their guidance counselor could help specifically with that. So maybe we could set up something to say, hey, this is an issue, and like we can help you with that. So.
Can I add something?
Yeah.
Younger kids might be looking up to, say, their older siblings or their older friends, and they'll see them dangerously coping by drinking or substance abuse, and they'll think it's okay. But we need to stop it before it starts at the younger levels and educate them so that once they do get to a, say, dark point in their life, they don't automatically turn to drugs or alcohol because that's what they've grown up seeing people do. Do you want to add something?
Going back to our generation, our level in high school, I believe we have all the information, like in our guidance counselor rooms, but it's not being communicated that we have this information. So we need to find a way to get that information out farther than the walls of the guidance counselor rooms, just so everyone knows this information and how to cope.
Did anyone ever give any thought to trying to combine some of the things you're learning in school with problem solving rather than, I know you describe it as coping, but everything in life is a problem that needs to be solved. It's a complex problem in many cases. There's simpler problems in other cases, but one of the things that you could do would be to implement problem solving in association with your classes and in association with that material that's available. People don't jump to material. I have a problem, I'm going to jump to this material. That's not how it works. It has to be done slowly and implemented step by step by step, because it's all a process. And the process isn't that different for people that have issues. The problem is a lot of them don't have problem-solving skills. They simply don't have the ability to put the blocks together, to solve a problem, so they don't know where to start. Giving them someplace to start at a younger age is a great point. You bring that up. That's what they have to understand. Life is not a roller coaster, right? You don't just get on it and go for a ride There are stops, turns, starts, bad turns, ups and downs. That's to be expected. But people don't seem to understand that that's just part of life. And these coping skills are something that you acquire. And they have to be acquired at an early age, like any other skill. I don't care whether it's a sport or something else. What do you learn? You learn skills. Then you get better at the skills and you go on to be successful in doing what's necessary. But those types of coping that you're talking about are problem solving. And I think the closer you can get to implementing problem solving type situations in school, that people get to them, can utilize them, and can solve their problem even in a group setting. But those skills, I think, are so important, and maybe a lot of that is missing because they just get overwhelmed. I'm overwhelmed because I don't have a formula to solve a personal problem. And your support is going to help them. The younger you can get them to implementing problem solving, the more it's going to be their responsibility to at least assist in solving their own problems.
May I follow up with two
Go right ahead.
Or maybe it should be better consider them two separate questions. When I was in high school, not too long ago, but for the voters out there also long enough ago, there was a portion of my health class, which actually was 2 weeks dedicated to, again, and it's not so much coping, but we'll call it that. I mean, it's coping. Healthy coping through exercise, through friendships, for love of friend and family and that. Do they still approach that in your current curriculum? Have you maybe not gotten to it yet?
They do approach it in the curriculum, but the way they approach it makes, like, the kids in our class laugh about it. Like,
Okay.
they don't take it seriously
Sure.
enough, which is the problem.
And is that because they're trying to relate to you and come off in kind
Yeah.
of a cringy way, or is that okay?
It's kind of like they're an adult, so they don't understand what I'm going through at this time.
Okay.
So they joke about it, and they don't take it seriously.
Right. I don't have kids yet, but I think all the parents attest that we all went through that stage at some point growing up. Yeah, so it seems. How successful, and this is the part two, do you think coming from someone like you, respected peers, or someone that can identify with, and don't get me wrong, and we're not minimizing, but a lot of the struggles that you're going through, we also went through, right? It's just different now. For example, bullying wasn't as pervasive when I was growing up because, well, frankly, the internet still, you had to dial up, so it wasn't as consistent, and we didn't have smartphones or texting at the time. So there are important differences, but it's also kind of the same. And in that time, we were told quite often, talk to your friends and family. Given your modern takes on these challenges, do you think that the peer support would be effective in a way? You think your friends would be, or even strangers or maybe just acquaintances, be comfortable reaching out to someone like you that can identify a little bit more?
I mean, I think they would, just because we get it more and we'd be able to relate to them at least on some level closer than an adult would.
Sure.
And, it's easier to talk to someone your own age. It's not like
Right.
talking to an adult could be like, oh, I have to do it like this, or I have to do it like this, or I have to be this, mature. But, talking to your friends, it's just like talking to your friends.
Right.
And it's just more, comfortable, and they can rely on us.
Right, and I imagine it's more comfortable too. They already know the people you're referring to and the situations and that. Okay. And is there any sort of system in that in place, either through the schools or just?
I'm not really sure. I don't think so.
Okay. Okay, interesting. Thank you.
Yeah.
Unfortunately, that only works if you're in a good circle of friends.
Yeah.
Because
Well, that's
when you're in a bad circle, you're getting advice from the
Yeah.
person that you grew up probably should not be listening to,
Yeah.
which I think
Right.
magnifies the problem as well.
Absolutely.
So, to what Mr. Scarano was saying, yeah, decision-making skills, us parents aren't necessarily the best at it, but it seems like it's getting worse with time. And, yeah, there's a big issue because and I work in a school, not in Tewksbury though, and one of the things I see is kids your age now, when you look at the impact of something you're about to do, you have a very short-term focus on what's the immediate impact, not worrying about what's going to happen down the road. And I think that's one of the pieces that needs to be part of this education process is you have to look beyond tomorrow, but to the future, because what you do today directly impacts you in the future.
A lot of people don't even think they have futures. Unfortunately, you probably know people like that just think there's no future in this, or they're down on everything that's going on. They don't understand, people bantering about politics or whatever. They don't understand, and they feel that there's no future. There has to be a sense of future. There has to be a sense of belonging. There has to be a sense of, we can do this together, because it takes more than an individual to do anything. Really are individuals so overaccomplished that, they're stars. There's a few, we all look up to them, but the rest of us really have to get together and pull a wagon together. And when you see people without futures, that's when you guys need to step forward as the next generation and say, there's help here for us. Not you, there's help here for us, because we're going through this together. And they have to understand that it's together. The moment they feel isolated, the moment they feel there's no future, you have someone out there that is in need of services, your services. If it's not your services, it's got to be someone else's services. But I think you guys together are doing just yeoman work in recognizing that a lot of people just see no future, and that's the start of apathy. I don't care anymore. That's where you guys have to step in and say, no, you do need to care, because we care about you. And we care about you because you're one of our peers, you're one of our contemporaries. We want to take you along with us through this journey of life. And you have to get them interested back into the program. And I know it's difficult. We all have had friends that want to check out. But even as adults, we have friends that want to check out. And we're constantly dragging them back in. Not in an embarrassing manner, not in a flagrant manner, but bringing them back in and showing them that there is someone there. Maybe they're not getting that at home. So that's where you guys have to step up. And you have to be that support, even briefly, temporarily, or whatever it is, right?
So any other questions or comments from the board?
Do you young people feel it's any role models that maybe people can relate to right now? Or you feel it's more of an individual thing? At one time I remember growing up, there were role models that people tried to emulate, but I'm not so sure with some of the role models, at least some of the things that I see, or how people would pick a role model anymore. But you young people are active, and you're seeing some people younger than you maybe get involved in some of these abuses and all. Do you feel there's any role models that collectively maybe you could agree upon that may be helpful, that you could maybe get their assistance for presentations you may want to put forth?
Okay, so I have a question for that. When you say role models, do you mean like people we could actually get in contact with, or like celebrity people that people could relate to and people that they like?
I know that there are people, for example, I'm going to have for different causes. Who's the football player and the baseball player that played professional, or is baseball?
There's a lot of them, and I think Tony is talking about people that have been there, been through it, picked up the sticks, and despite their success, despite they've reached the pinnacles of their careers, they are not immune to these problems. Nobody is.
Yeah.
And then you have other people out there that have actually rebuilt their lives, and maybe looking to those types of people. You don't have to be a celebrity. You don't have to be a movie star. You know what you have to be? A realist. I realized that I had a problem. I dealt with it. Look at the support groups that I had to interact with to get there. And now I've gone from a low that I thought was the lowest point to a high that I can't get any higher, right? And it's not related to alcohol or drugs.
Yeah.
It's related to that. It's related to that plane of life that everyone tries to achieve. And Tony, I think, is talking about these types of people that have done it.
Yeah.
And associating yourselves with those kind of people makes your group stronger. It chases generations. It compresses and brings them together. So I think Tony's idea is to associate with successful people that have been through it, done it, and are now back on a road to sobriety, a road to family life, and a road to all the things that they thought they had given up on because there was no future.
I think people can relate to when there's they call it a wah-wah moment. It's when Helen Keller realized that it was water that Annie Sullivan was trying to type those letters into her finger, into her hand, palm of her hand. But sometimes when people feel troubled or feel despair, sometimes there's a person that just by speaking, you'll find that, gee, I'm not the only one that has these issues. I'm not the only one that, you know, feels like this or has ever felt like that. And there are ways to channel this despair into more positive influences. So that's why I had brought that up. I mean, I don't pretend to know who all the younger people now would consider potential role models, but I'm sure with, you know, rapid access to, you know, internet, Instagram, Facebook, if you probably Google something, there'd be someone that may have a similar story to share, and that may be the wah-wah moment or the connection for young people to find someone that they can relate to. You know, not everyone's gonna, just like not everyone likes bacon, eggs, or cereal. It's like you find that, and I think that the more diversity you have regarding the people that you deal with, you may be able to make that connection.
I only have one other thing to add on that. You folks have the ability to start using social media responsibly. It hasn't been used responsibly. It's been abused, as a matter of fact. And people join in the abuse because they either find it fun or they find it entertaining. But, you know, just for the fact that social media has brought people together to show where they're going, where they're shopping, imagine if you could take social media and show where to go if you have a little bit of a problem where you want to be able to talk to. We have a group that is using social media. Join us if you've ever felt this way, if you've ever felt this, abandoned, whatever. You guys have the ability, because you're so good at using it. We're not. We're terrible at it, okay? We look at it as entertainment, etc. But I think you guys have a very good opportunity to use social media in the most constructive way possible, probably the way people actually thought the internet should work, rather than the way it's currently working.
I think that's a great point, because by using social media responsibly, it's real important, because sometimes I think that what people do see, at least my observations, with what happens with social media is there are some people that, you know, they embellish or they outright lie about their experiences. Oh, I'm doing this today, I'm doing that today. I mean, in the realm of media, you can make things look different than what they appear, and sometimes that may make people, you know, I know one thing, when you see someone on a cover of a magazine, you know, people think that, you know, they've been airbrushed. Pictures could give you false representations of what life is, and many young people think that that's the way it is. So by using social media, that's a great point.
Yeah, and you can point out that, and Tony raises a great point, everything on that thing, it shouldn't be called Facebook maybe. Maybe sometimes it should be called Fakebook.
Yeah.
Because people look at it and they go, oh, this one's doing so great, this one's doing... A lot of times that false hope and embellishment leads to depression.
And more despair.
Yeah, because, and you know what? You guys identifying that stuff and calling it out. Call it out. Don't let it go by the wayside. No one will ever criticize you for calling it out and saying, if it seems too good to be true, it probably isn't. So come back down to reality, join our group, let's talk about what you think is great and what probably isn't really that great. But you have the chance to reach that we can't, right? We can't do it. You guys can. And it's so good to see you here because groups like you, if you can exponentially increase yourselves, so imagine if you guys can create one more of your little 4 group here and do it in the next town, Wilmington. Do it in the next town. And then you guys start talking as groups in each one of these towns and watch how they expand. You know how the internet works. It will catch fire. It will catch fire because people are looking for a resource that you can provide them.
So thank you very much tonight. And Maria, thank you very much for bringing up this idea in the first place.
We appreciate it, thank you.
Thank you.
And I hope to have you before us again in the future so we can get an update from you.
Oh, we'd love to hear an update in a couple of months, see if you can't implement some of these things. That would be wonderful.
No pressure there.
My wheels are turning. And we'll invite you to Tewksbury Cares when we get it, right, Maria? Yes.
Great, well, thank you.
I gotta move these chairs back. Out, no, can I go?
So I'll be speaking on Sec Day, but the next thing we have on the agenda is under direct reports, update and Board of Health outstanding issues. So I think there are 1 or 2 that we'd like to sort of discuss with you and get your input from the state government side.
Which ones are those?
Tobacco.
Tim Tebow.
So one of the things we've been discussing, and one of the selectmen approaches at the town meeting was just concern about increased prevalence of vaping, especially in high schoolers.
Right.
And reading this week, I'm not sure if it was maybe in the state senate that they were looking at putting forth a bill to ban flavored vaping products.
They were,
tobacco.
part of the Senate budget proposal this year includes an outside section to bring vape products in line with taxation of other nicotine-based substance, and as well as bringing them into compliance with state law in regards to primarily cigars, cigarillos, and other cigarettes which were marketed as, green apple or grape flavored or whatever there was back when I was in high school there. And the Senate does have a proposal for that. I'm not aware, and then this is just it's a naivety.
The FDA wants to get involved in.
I imagine they would. The Obama administration rolled forward those regulations regards to specifically to flavored tobacco products. I don't know if this FDA will do so, but there's a precedent set that most states are pushing towards it because they're getting more and more reports of vaping in schools. And in fact, I bet you if you looked at nicotine abuse among groups which are you considered illegal, under either 21 or 18, reflective of the community, I bet we see a reversal of the smoking trend right now. Just due to the prevalence, it's discreet, looks like USB drive, but I'm preaching to the choir. You all know that. It's just a wave of the hands in the school restroom and the evidence is destroyed, so.
Even when you're driving down the street, I saw the other day, someone they had their window cracked and it's like the car was on fire
Yeah.
when you saw smoke, so.
Right.
It's amazing. It makes cigarette, you didn't notice that much when people were smoking real cigarettes.
And
I
it-
can't imagine the volume.
It drives me up the wall because what you do in the privacy of your own home is the privacy of your own home, but then you just either smell cotton, grape, cherry flavored, or marijuana, whichever one is pouring out the car window.
Sure, it's amazing.
Yeah, it really is.
So one of the challenges we have is that while we can regulate certain things and we can tighten the screws on our tobacco regulation policy, vaping is a whole different issue because you can get that stuff on Amazon. So it's like we can regulate where it's sold in our stores here, potentially as strict as what Bill Rick is looking at doing if it passes court challenge. But it's an education piece, and again, it's the parental side of dismissing or not being aware of the potential hazards, and it's...
That's it. It seems to, and this is partly in regards to the companies, they did it, as you mentioned, was originally marketed as smoking cessation, right?
Yeah.
Blue, which was the very first vape to hit the market en masse, I assume in the commercials, black and white, except for the actual thing was in color because it was all blue. So take back the power, we can do it indoors, you know, we control our own bodies as adults. And then that disappeared in the first 6 months. If you notice, then it became kind of a fun thing, and then it just kind of disappeared from marketing altogether.
Like a lot of things changed. Remember when cable TV was gonna be no commercials?
That's,
That was the big thing. I don't like so.
Once
you
the
can
market
sit-
is set.
Once
you
the
know,
market
Market
they-
set.
They see it and
Yeah.
it
and,
expands.
and you know, my professional training through university was economics, and it's a very particular market because it's a market that, I mean, it's a consistent demand. It's an inflexible market. It really is inelastic. We can raise prices and dissuade it, but there's a certain point which, believe it or not, the marginal decrease that you would see in a smoker is immune to taxation. That guy will buy it for $100 a pack, really. I mean, that's obviously a bit of hyperbole.
That
The
makes
tax will never
sense.
hit that out. But at that point, the taxation does nothing. It's
Well,
just,
then go legal on the black market.
exactly, it'll emerge. It's the same thing where some of these kids getting hooked on opioids are no longer paying $60 a pill. They're paying $5 for that same fix on a different product. They will just change
More
the
enhanced
vehicle.
Project, that, I mean.
Sometimes the worse.
Yeah.
You know, the Chapter 55 report, and for those who might be watching this that don't know, you know Chapter 55, it was a comprehensive study done by the state, primarily of opioids, but it's actually applicable to non-opioid-based dependency issues. We've seen this remarkable spike in polysubstance abuse, where she pointed out the drinking, and that one time they take the pill and they don't think nothing's happened. I mean, unfortunately, it took the life of a young kid that I knew over in Wilmington not too long ago. It's like one time, that was it. And it's a lot different than even when I was in school going through DARE, where, you know, we were told about gateway drugs and slippery slopes, and then there was a whole myriad of research. What was this true, is not to an extent. This is absolutely, I mean, the data is precisely clear now that these kids are, they think it's innocent. It's just one and done. It really is one and done. And I think vaping, because it's an addictive thing, does open the door. And I don't mean to sound like, you know, like your kid's gonna have one puff off a vape, and the next thing you know, they're gonna be unemployed and stealing or selling or falling apart, because as we know, dependency no longer is just what you think the stereotype is. It's much more complex. It affects everybody. There's plenty of millionaires out there who have the same issues. But I think with vaping, it kind of does set that precedent early on, that we can get away with it and it's cool. And if we can get away with that, then we can get away with a lot more. And I agree with you, Mr. Barry. I think education is the only one that really is going to save us at this point, getting in early and saying, look, just because you saw it on TV, because you saw it was cool, because you saw someone that was handsome or beautiful doing it,
I'm just gonna tell you a story about growing up with my parents. They literally would watch commercials and they would look at us and go, why do you think that this is persuading you to do this? They would ask us. They literally knew in advance, and I'm not saying that they were any smarter than anyone else, but they understood consumerism.
right.
Parents do not understand consumerism. The consumerism is the fact that you can get away with, it isn't just happening on TV or radio, it's happening in real life.
That's right.
That's the consumerism. They're watching other people vape. Bang! That's the consumerism.
I mean, how,
They are consumers by heart. They have been trained to be consumers. They will be trained to be consumers for the rest of their lives. And this is just a reality consumer commercial.
the Marlboro Man.
That's it. So when you see, and I like your idea about education, but education starts with asking why you are attracted to this product and what decisions you can make to avoid it, make it yourself, or whatever it is. But if you don't realize that you are being attracted to this product like a fly is attracted to honey or some other, until they realize that, it's going to be successful from a standpoint of media, and it's going to be a success just by the fact that someone's doing it in front of you. That's just free advertising.
I mean, I'm hopeful that if the Senate does bring in vape products and other non-traditional nicotine vessels and avenues into compliance with the way we treat other traditional cigarettes and such, that it will be earmarked specifically for early intervention in schools. To be honest, they're doing their budget next week, so I'll be able to see what the finalized language is when it goes through the process, and I'm happy to relay that back. And I'm sure Barry Feingold, our state senator, has a number of opinions on this as well. I'm telling you, as now not as young person, but still someone that again went through the DARE program, that was a great intervention opportunity for the school system, but it doesn't reach every kid. I had it through coaches. I'm very lucky through my parents. I had it through my scout leaders. I had it through church folks. And it was a number of layers where if one didn't resonate with me, there was 2 or 3 others. Right, and even through my thick 13-year-old skull at the time, I realized, I said, geez, 6, 7 times that this has been said to me. There's got to be something about it. It's not just, and I never thought my parents as lame or uncool or anything like that. But again, it's not, it's my dad just telling me another rule or anything. It's like, well, he said this. And my coach said this as well. And
They can't all be wrong.
right, exactly. You start to realize, we're humans, right? We're hardwired to survive by basic pattern recognition. And after a while, like I said, even as a young man, I realized that, wow, there's a pattern going on here. And all it takes is that one connection. You all know that. One connection, whether it's a teacher, whether it's a coach, whether it's the pastor, whether it's grandma, grandpa, it doesn't matter. Right, the Wawa connection that you said. It's just one. And I think we, as our community leaders, need to kind of see what we can do, because
Then it opens up once you connect. It's like,
I thought that those
they're remarkable
young
young
adults
ladies.
that were here
Remarkable.
today would be the kind of people that could put out a PSA that would counteract what's happening out there. And the more that they become the message, the better off we are at. I know the legislature's trying hard. I know that there's all these studies.
Right.
But until there's self-realization and that people want to take care of themselves in a healthy manner, until they get the message, and maybe it does take 6 or 7 of those things to say, take care of yourself. You saw the old lung commercials, the devastation from the smoking. That worked.
Breaking eggs on frying pans.
Those things all worked. They weren't
Right.
they weren't complicated. And I think that, having people like that stepping up and working with you, that's a real.
Well, I'd hope so. And I think the young lady, Lindsay, there, if I'm remembering the order correct, had a great point in which, and it echoes yours, Mr. Scarano, I think, it's not even I think, I know, because there's science, there's real math behind it. So people who rejected social media report higher levels of self-happiness. And the reason is that people who use it never show the bad side, right? And that goes true across the board. You never say, you might say my kid's sick because we're a little different and there's just trusted friends, but when you're their age and there's several thousand people following you, you're not going to say my dog's ill. You're going to show the vacation. You're going to show getting a new dog, a new phone. So as a young person, I'm looking at all these other profiles of people going, Jesus, everything goes right in their life. And I feel nothing but sad. And I don't feel relatable. And it's amazing. It really is amazing. So I think
That's half the battle, isn't it?
It is.
This is what
It is.
triggers them. It is a trigger. It triggers them to take the next step. It has broken down every inhibition that they were ever taught, right? Because they're feeling bad about themselves, or they're feeling bad about themselves in their own little private group. That breaks down all those inhibitions, and it's so easy to get tripped up.
Well, like you said, you can. I like when you charge them, because I look at them as beyond. They're not kids; those were leaders. And when you say you can charge them to break this echo chamber, bring some positivity. I think hopefully those 4, as you recommended, could be that beam of light breaking through the crowd. Exactly, and I really respect the point where she said we need to reach these kids behind the phone, where there's maybe that veil of shame. Maybe they don't want to step out and actually speak to a friend and say it, but that kind of anonymous connection, which said, look, I don't even know if I have a problem. Because I look at it as a difference, right? And they're going through a point in life where we naturally rebel at that age. So there's a difference between them stealing the one beer and then realizing it was a mistake and having that moment of self-realization and having that learning moment of what it means to be responsible as an adult and all that. I think that's a teachable moment. And I think that you've done terrific work, and these young ladies have done in saying that now these kids are no longer taking that teachable moment. They're no longer talking to mom and dad. Now they're just going all out.
And do they even talk? We're talking
Right,
about how.
exactly.
Do they even talk? I mean, it's one thing to talk to people, but using the media as a mechanism to get out to them, because my experience has been that, you know, yeah, they talk once in a while, but what is going on behind the scenes, it seems like there's a lot more information out there in the texting or in cyberspace, so maybe there has to be, I don't wanna say a mechanism, but a way to have PSAs or whatever that come out on Instagram.
You know,
because-
one of the things we had when we were growing up is shows like Lassie. At the end of Lassie, there was always, well, you see, Timmy, it's like this.
Right.
There was a
moral.
message. There
Leave it
was,
to Beaver.
that's not, it doesn't matter. Whatever those shows were, they had a purpose. And the purpose was try to get a point across for the people that were watching, that were feeling the same way that the show was characterizing things. You don't have that anymore.
Yeah.
The characterizations that are going on TV now are so far out there, right? There is no positive message about what direction you should take to answer a question, and there's no learning portion of or actual attribute that made that show worthy of even investing a half hour.
You know, it's funny, Netflix had the documentary on Mr. Rogers' life there, and it was kind of, yeah, it really tore at you coming back, realizing, I'm like, wow, I come home and I watch that, and like...
Got a
yeah.
message.
Beyond that, though, too, I mean, it hits you early, and as you know, right, you're learning those positive messages,
Yeah.
and sure, you might forget the avenue which you learned it, be it, you know, Lassie, Leave It to Beaver, whatever, but subliminally that stays with you. And then years later, it was kind of funny. It all emerged out again. I went,
Yeah.
wow, I really...
And that's my point with these people.
Yeah.
They have the ability to become the new Lassies, the new Leave It to Beavers. They can leave a positive message even after putting out, you know, come to us because we're here and we can hear that. But they can have that positive reflection because you're not going to get it anywhere else. You're not going to get it from mainstream TV or anything else. It's going to take groups of like these brave adults, young adults, to come forward and say, we got to take control of this situation and become leaders. That's what you're doing for them. 4 leaders showed up here tonight. That's amazing.
There's actually 6 of them, but 2 of them had sports.
Okay, so there's 6 leaders.
Were they sophomores, juniors?
They're all freshmen.
Freshmen?
Wow.
Wonderful. They
And
did.
when I was speaking with them yesterday and I was telling them, they were talking about trying to talk about some type of policy change. When I realized they were all freshmen, I told them how it was realistic that they could see it in their years before high school, because policy change takes time, and they have time. So I don't know how that whole group of kids got together. Those 6 just kind of matched in together, and that was it, out of maybe about 60 kids. And they came together, and I'm going to work with them all the way till they graduate.
I didn't want to get off your point, but
Please.
working with those kind of folks in the legislative thing with the vaping, et cetera, I think that's your army right there.
I think at some point, as discuss the logistics of getting up there to air their voice too. I mean, obviously I can champion to the committee, but it's different when it's a colleague, right? You know, and you respect your colleagues, that's fine and well. But when you get someone, you get that voice, the kid that took the time, and we're not that far from Boston, but to get them in there and to say, you're putting more money towards, you know, having law enforcement come in, which is great, you can teach us, but not everyone might relate that way. You have more money having our teachers come in and teach us, but not everyone may relate that way. Or you're forgetting my mom and dad in this all. I mean, right, it's through, like they said, through the eyes of the child. Sometimes the solution's so simple. Well, they're not children, but they're still young enough to identify and give us what we might no longer see as an avenue. So I hope to follow up, and I'm sure I'll get extensive notes.
That's
from them.
why we did what we did today.
Right.
There were multiple ideas going on. Maria had children.
Well,
You had met Mary and Ryan. You had talked to you, and we said, they need to see, you will hear, and you will listen.
they have
It was
to.
a message, you were like, this is important to them, they are excited you came today. We weren't sure who to invite, or where this was gonna go, or, you know, how many people are to include, but you're the one, you know, you're the chosen one.
Yes.
You know,
Flatter me.
No, I'm serious, that you actually came, and
It
You
shows that
said they were
people
very
care.
excited.
Very
right?
excited.
Take the time to care in your busy schedule.
So I think it worked. I
Yeah.
think you've, I
agree.
think this is a great thing.
And I know you all share the same thing. Sometimes it seems like a kind of a hopeless crisis, no matter what kind of demon we're fighting here, because we're on the front lines, right? So we're always hearing the stories of someone who had let's face it, I've heard enough stories where it gets frustrating and frankly, it gets almost depressing at times where they're an A&B student, they were captain of the football team, or she did drama, she did dance, and then all of a sudden, it was a freshman year at college, they came home, they changed, they struggled, and then
That's it.
one time the Narcan doesn't work. And that's the end of it. So, to be honest, that was very enlightening and upbeat for me too to see. I know it makes me happy to know that there's 6 thanks to your guidance, but now 4 from the second. Right, enough's enough.
What was
It's kinda
really,
nice.
really fascinating is they didn't realize who you were. And I was
Is that a good
talking
thing or a
about,
bad thing?
I was talking about, having a representative, a new representative, and just kind of setting you up. And Deborah Glass came in, and she said, "Oh, I had him in school."
That's
And
right.
the 4 of them, they just squealed with excitement because she has respect for you.
Thank you.
It was just wonderful.
Thank
So-
you. I owe a
She
lot
says
to that
hi,
school.
by the way.
That's a shame.
She'd be really upset with me if I didn't say that.
Oh, I appreciate it. I'll let her know.
There's all the good connections. I mean, you grew up in the community.
Well, that's-
I mean, just like I said, everyone has that one person or a couple of people that they make that connection with, which may or may not be the same for other people.
It's amazing, though. When I was in high school, and not to knock kids my age, because there's look, I graduated with Scott Oberg, probably the best athlete the town's seen in decades, and he was a great guy. But, it's funny, some of us were kind of involved, but I know he was here the other day. I know, unfortunately, I was busy. But he, getting back to him, it's amazing between them, between Rosalind Pink, who I know we all know, and that it's amazing now that their generation all of a sudden really said, okay, you know what, enough just posting status updates about it, let's actually start engaging. I like that. It's a great sign. I don't know if it's just, I see it in Wilmington too, so I don't know if it's just a Merrimack Valley thing. Hopefully it's nationwide. Hopefully it's worldwide. It's great to see some positivity and ambition there. So like I said, I know writing some things down to follow up, maybe come October, I know we always have the Memorial Night, and it's important to remember that, and the folks who no matter what the addiction, they were robbed from us too, but I think maybe we can end the week maybe with something more positive. Get some young leaders up there saying, look, we've lost, we made some mistakes, we ignored this, we looked at this as a criminal issue for years, we see it as a public health issue now. We got a capable board, we got capable young people, kind of maybe end on a little more positivity there. And I think that will help with the healing process for a lot of people who are lost too, and that perhaps there wasn't lost or suffering in vain. Right, exactly, that people are realizing it, and you know what, maybe they had a loss, but maybe they can save someone else from having to go through that same process. So, yeah, whatever I can do.
So one other quick thing,
Please.
coming back to
You
the
got me all night.
tobacco reg.
You're
or,
paying, your tax dollars pay for me to be
legislation
here to
going
get
through
your
the
money's worth.
the Senate right now. We're mindful of the Bruins tonight.
Sorry.
All night until the first period.
That's fine by me.
I'm going to make an ask of you.
Please.
The tobacco control program had been self-funded from fines collected from tobacco sales violations.
No,
Or
that's
the-
from the tax.
Tax.
From tax,
It was all
yeah.
supposed to go
Yeah.
into
Right.
that, which it doesn't.
How much of it's going to the general fund now? That's my question.
All we have
All of it?
now is enough to maintain our one coordinator, and he is able to hire a few youth to go around and do checks. And
Okay.
it's barely enough. We actually had to try and come up with some money to restore, a little bit. They were gonna cut him.
Okay.
And he services 16 communities, and we're down, I think, 1 to 2 checks. We used to do, 4 spot checks when I say checks of sales to minors.
Mhm.
So that's what you're referring to.
Right, and more in line with the renewed focus on the vaping epidemic, and these sales violations could go in and go not only for tobacco products, but for vaping products, because both are covered under our regulation. And I just look at, yes, education is one part of it,
Right.
but I think we need to have the means to increase the sales checks of both tobacco and vaping products in the
They won't-
stores as well, that attack it from both ends.
They're one and the same. I look at it as a tobacco and vaping. And unfortunately, I think people are a little ignorant. It's just water vapor. It's not.
I think they have to realize there's consequences to everything, and I think a lot of people don't. I mean, the pendulum has really shifted where, just what we were talking about with kids, I mean, you know, smoking has had, you know, issues all along, and vaping is, you know, just an extension of that. And by not, it's always a check and balance, and I think what we're doing by having these spot checks is, it goes back to what we were saying before. People that have businesses, you have to keep policing yourself. When we all live together in a community, you know, there's right and wrong, and people have to understand that. And I think that this is just the ability to create a little bit more checks and balances to keep people wanting to be trying to do the right thing. I mean, you can get beat no matter what, I mean, by fooling it, but it keeps people on their toes.
There's no doubt about it. I agree with you, but I see it much more bifurcated and segmented. Because even in our diverse society, you have cultures, groups that don't see it this way.
We know that. yeah.
Okay, so let me tell you, it's okay to talk about diversity, it's okay to want diversity, but you have to understand that with that comes cultural issues. There are cultures out there that simply do not see this vaping thing
Right.
the way we do. They are never gonna comply because they're in their own little private Idaho. And that is something that we really need to look at, because people need to reach out to those groups, identify them, reach out to them, and try to get them to assimilate an idea. I'm not saying assimilate as, you know, their talk about become an American. Assimilate a health idea. It's not the same.
Well, that's what we're promulgating, the health ideas. I mean, so it's like, you can believe what you want, but, okay, I'd love to drive fast on the highways all the time and the roads, but I don't, because there's risk and there's dangers to yourself and other people, even if you have.
And that's where I'm going with this thing. So can you imagine those 4 leaders that were here tonight, each one of them from a different culture, that have the same goal to bring the health and bring the people together into that group, that's the outreach. Because, like, when you talk about legislation, right, it's just across the board. It's, you know, big wide brush.
Right.
But it doesn't reach into the lifestyle of people that are coming here that have bad habits, and those bad habits are being spread, right? So if we could reach into each one of those enclaves and try to interject some good health ideas and interject some good ideas that cessation and these types of things are key. That's key.
Oh, sorry.
Oh, no, I was gonna say that I think is in the same vein, that when you said, who are our role models now?
Yeah,
Right.
because we're regardless of where people are coming from, there's a set standard of rules and plans and regulations that we have to follow in order to function. If not, you're gonna have total anarchy.
Right.
So, when I look at where we're coming from, we are, as a board, trying to protect the public of our community. All we can really do is have some input in our community by basing all this information, and I think we're a learned group here, all of us, that we listen to what is out there, and, you know, the science, the empirical evidence that goes on, and we're trying to come up with something that will help protect our community. But I also think that's why I like, you know, what Ray was saying about, you know, we need some funding to maintain the checks and balances, because everyone needs, I like to call it a recalibration check. Sometimes you're straying a little bit this way, a little bit, I mean, and I just think that by having I don't think people think there are consequences now for anything. It's almost like you can do whatever you want. And there's, I mean, we know where the world is going. I think the pendulum has to shift, and I think that's what's really good about these young people that came in today. They have concerns, and, you know, what you said about social media, let them be responsible, because, I mean, truly, I don't wanna say that there isn't, but you wonder how much responsibility or responsible use of social media is going on, because I'm not, from just some of the stuff I see second and third hand, from my kids and from other people, you're like, some of it may be entertaining, it may be funny, but I can't really say I've seen anything really responsible lately. I'm sure there has been something that I may have missed, but yeah,
It's not
so it's
fun.
great, and you're right about all these young people coming from backgrounds, they can, you know, they can help bring together some of these standards, but I think that, you know, that's what we're here to do. We're here to help provide guidance for what's going on, and whether people have personal beliefs that they don't feel it's an issue or not, there has to be those checks and balances, and just what we're talking about Ron Beauregard and his group that came through, but I think there has to be some kind of funding for that.
Well, coming back to it,
Yes.
it's great to have a potential law enacted that
Right.
restricts this, but that's no good if you don't have checks and balances.
Right, laws
And
are
that's
two
where it
parts.
comes back to, there's gotta be some way to get the funding restored.
You make an excellent point. A law is nothing but text without the enforcement.
Right.
So, now, when you said, right, it was originally self-funded out, is that because of declining tobacco sales due to education, or
No, it was
just no?
redirected.
Okay.
Revenue
The funds are
redirection.
redirected
And
to
is that-
wherever, we don't know.
Okay.
Kind
And
of like
that's-
the excise
They don't tell
tax
us.
after World
Yeah.
War
Yeah.
II.
Or the pipe bonds,
Or the
or
pipe
anything
bonds, yeah.
else out there that was.
It's like, it's going somewhere, they're collecting it.
Yeah, there's a gazebo out there.
I
and-
actually had
Okay.
a conversation with someone from the state to just check with something, and the funds were received. They've been, checks have been cleared, but no one has a record on their end where it is. So
Sure.
it's like-
Yeah, sounds about right. Par
So
for the
that's all
course.
it asks, is that if there was some way we could find out how that revenue can get
I'm sure it's all right.
Revenue's allocated?
reallocated back to the,
Redirected, you're talking.
I'm sure it had
redirected
an
back to
evolution.
where it needs
Chop,
to be
chop, chop.
in order to get that, hopefully law that will be passed,
I agree.
monitored.
I can tell you, Ron is an individual that is doing yeoman's work
Oh, yeah, I'm sure.
in multiple communities, and is pressured at every turn to somehow expend resources in a more economical manner than he's currently doing. He has to reinvent the wheel on budgeting
There's not-
from quarter to quarter.
There's no budget anymore.
That's
There
right,
used to
that's
be
what I
a
mean.
lot of
Okay.
things, there were clocks that said, not under, 21, and there were,
Right.
there's all kinds of
Remember the calendars.
information.
But I'll tell you what, one of the opportunities, and I thought the lottery was doing an unbelievable job at that, when the lottery first started, they were all about giving the vendors signage, checking your age, you better have been born by this date. All of that stuff was in the store. It's whether that budget has been shaved so that they can't look at those anymore, but those little assists
Right.
actually helped Ron.
Well, that's what creates the culture, the thing that we're seeking to change along with those young leaders. But it's those kinds of things which, right, they might have been, we didn't even notice them consciously, but in our subconscious and our counter, that's why it became such an idea where in our mind, well, no, that's 21 and older. The kids shy away, so they start seeing more and more signage. I think it's an active deterrent there as they approach the counter.
That message is something that would help them
Right.
in their quest to and those little things can be slid in innocuously.
Right, and the thing is that $1 there saves 50. Let's be honest, probably 500, or God knows at this rate the
What would
healthcare
it
cost for me.
save? What would it save in health
5,000,
connected
500,000,
fees?
right?
Right.
Through the roof. COPD is huge, and other pulmonary issues from smoking at this point. I imagine with health care boosting survival rates through something like that, but the costs also rising, to dissuade people from going down that path now, a healthier, more productive life. It's not just physically, but it's also morally the right path to try to focus folks on.
The only, the constant, the one non-changing element of everything we talk about and do is human nature.
That's right.
So, human nature is probably, that's the biggest challenge, I think.
That's only a certain point.
And my big concern is, as Berwick is looking, I believe it restricting sale of vaping products, the 21 and over
Okay.
tobacco retail locations. In our town, and this is why I'm really concerned about needing more compliance checks, our over 21 tobacco retailers have a 100% sales violation. And I look at them as being, should be the models of how to sell tobacco products correctly in the community.
Right.
Instead, they have, each of them has had at least a sales violation, if not more.
Right. It's the same, and there was a common thing too. I remember we were discussing before the town voted on the local article for retail marijuana. We're looking at these places where there's a constant presence, and there's no constant presence, and that was a big thing, was the sales violations. It is very surprising. So you're looking for, you said, additional funding to help Ron out. Is that just for him, or are we looking to expand? Like, what's the
If
ask?
he could just maintain what he was doing before.
I guess to
Right.
restore funding, or however, I don't know what funding they had before, but I guess to make sure that there is a fiscal appropriation associated with hopefully the passage of the law that will actually mean that the law can be enforced.
So why don't we get you a little narrative from Ron on what he's doing,
An ongoing.
on what he's doing,
Maybe for
what he's doing
revolving-
on his
yeah,
current
revolving
little
fund,
budget, and what he'd like to see, so he could increase that presence.
I'll make it easier for you. Email me his name and phone number, and I'll just call him
Do
directly.
that,
That
and I'm
sounds good.
sure he
Get out the middleman.
can point you to
Yeah.
who you need to speak with above him, that's,
Right,
that
exactly.
he's
Yeah.
dealing with.
Exactly. I'm sure that it's through a DPH revolving line item
But
within
what's,
the budget.
we talk about marketing, and what we've done by putting now all flavors into an over 21, we've created a desire to open over 21 stores now.
Right.
So we only have, well, not only, we have 4 or 5 now, but the desire, because people have lost large segment of their income, so they're now devising ways to become over 21. And so we need to then not just, we need to sting them just for walking in the door, we need to, it's not once or twice a year, it should be many times a year.
Right.
An army trying to get in there, but, so we've created a new niche, we've created that. And if we take, our selectman is concerned about all the paraphernalia now that's all over the convenience stores and the gas stations. He's horrified, really,
Car
to be
wash.
honest, with walking in and just seeing
Ridiculous.
all the glass, bongs and pipes and all those things, and he's like, this has gotta go.
For
This has
tobacco
got
use
to
only.
go.
Mhm.
Yeah, and.
I remember seeing them at
he's-
Hampton
he's-
Beach often, the
really?
displays, when growing up as a teenager
Talk
next to
about
them.
almost
not-
like slot
not being in
machines
the
in the
loop. We
restaurants
don't know
in
where
Vegas,
he's
right?
been.
Right, exactly,
Right.
literally.
So that's a big thing, but again, we start putting them all into 21 stores, we're gonna have more of those and more of those, so.
I just wanted to add something when you're talking about COPD. When I talk with some emergency room nurses, we're seeing young kids coming in with popcorn
Yeah.
lung. Popcorn lung, and they're 14, 15, 16 years old. They haven't even had a chance yet.
Right. Well,
So
that's-
it is really multiplying, and the ages is getting lower and lower and lower.
I mean, at least with the studies before cigarettes, you know what you were getting into.
Mhm.
Now with these new
Those
liquids.
are way down,
ship-
smoking is way down.
Well,
Well, the tobacco company said, wow, it's way down, let's create something new.
Well, you know what they're investing in now.
Yeah, they invested in vaping, I think Brown and
Yeah.
Williamson
And
and.
marijuana and vaping.
Marijuana
Yeah, yeah.
sites were.
oh yeah, all of them. British Tobacco,
Was it
Marlboro.
Marlboro, whatever it was.
They all
I know
got-
we had
Very
that at our
smart.
last meeting.
Very smart.
And I guarantee that with their expertise and their capital, they will take over the marijuana market if it ever goes federally, so.
Unfortunately, the little man's not going on.
No,
that.
it's just.
They're already selling out, it's not even close, they got a license, they got a location, and the next move, sell it. There is no, well, we'll sell it to another person who wants to be an entrepreneur in this business, that's not happening.
No.
because the entrepreneur can't even finance it.
No.
Can't do it.
The only thing is, it's a buyout, it's a direct pipeline, there is no middleman, there will never be another middleman, and there will be no middleman entrepreneurs taking over these small shops. They will become corporate vehicles driven directly at the population like they were coming down a
To
sidewalk.
be honest, we even have shops. When I was at UPS, I was delivering dog food directly from the factory.
Yeah.
It's not, it's gonna be dropped off at your side door within 10 years.
Sure.
Yeah, that's just the way I feel like it goes. So,
Well, hopefully, anything you can do on that, we're passing Ron's number along, and
Yeah.
what's next?
you got me, yeah, what else you got?
I think that was really it in fact, unless,
You can call me back anytime.
I do have one other thing, and that is, and this isn't on anyone's radar except for the chief of police here and many other chiefs, which is the body work bill
Mhm.
that is, you are supporting.
Right, right, and with actually, as one of your members can attest to, now with some potential changes in an examination, but yeah, I heard,
So the concern with the body work are those that fly under the radar that are not massage in there, they're not under anything, any guise. It's probably been big in the news lately with certain big sports games, with Florida. And it really shouldn't be just a local regulation. And there is a bill that would fill that gap. There's a gap right now that people just say, well, I do, I don't want to pick out anything, because you can't say Reiki.
No, but they make it up as they go
They're
along.
making it up as they go along.
That's the problem.
And it's trafficking and such, and it's not something that really should just be on the boards of health, because we would go in looking at the health things,
Right.
and then that's what happened in Florida. It was an inspection, and someone said, I think someone's living here. That's exactly how it started, even though they didn't find actually anyone living there, and they came on something else.
right.
But, can you tell me, is it Montgomery?
Montigny.
Yeah, Senator Montigny.
Yes. So is that going forward? Do we know if that's going forward?
I mean, to be honest with you, it seemed to be pretty universally supported at first, because you look at human trafficking and you just go, that's repulsive, and
But
right,
it's come up
universally.
many times.
And it has. But it seems that there's been a fair amount of folks within the various professions who said, hold on, I'm gonna tell you as a professional what you should be looking for. Because while you might be looking within our field, you're not identifying the right weeds to pull out, right? We're normal, we belong here, we're job creators, we have a successful, thriving business well within the confines of the laws. So, I don't know, Montigny said that his office had overhauled a number of the things on them. And again, this is just general press within out there. It's not something I specifically, called and spoke to him about at the time. I don't know how they're going to address it. I imagine that on something like this, with so many various interested parties, being the small business owners, being law enforcement, both state, federal, and local, now our local boards of health, our Department of Public Health, and then with even an international component, especially given as certain cities who have ethnic populations who might subscribe to such practices more so than, say, Tewksbury or Barica or Wilmington might. I think they're going to have another conversation about it. I just don't see. I mean, and don't get me wrong, it could be called up tomorrow and move through.
Not likely to be a quick resolution.
Exactly, that's my gut
Just a lot
feeling.
going on.
I mean, right, you never say never, but I don't see at this point it moving forward particularly quickly, especially with valid concerns from practitioners,
businesses.
from law enforcement, right, and from boards of health saying, we all agree on the end result, we disagree on how to get there.
That's because most of the people have licenses as well too, right, for these? They have
That's
state
correct, but
licenses, yeah.
as folks pointed out to me, right, all of a sudden, there's a complete rollback of people who have gone through legitimate training again.
Mhm.
Right, it's like as all of a sudden the state came forward and said, well, Tewksbury high diplomas are no longer good. Sorry. You're going, wait a second, what, I went through it, is there, what,
But
why?
if it created a professional annual, requirement that you show you don't have any illegal,
Right,
charges against you in that particular year, and that everyone in that place has to have a certification it gives the police justification to even just walk in and just say, spot check, okay, do all of you have a certification, or all you,
Well-
they need that, they just need the vehicle to be able to go in and check these things.
I agree,
I just appreciate the.
oh yeah, no, please, my only reservation about the vehicle is just like when we were talking about cell phone use yesterday, is the number one concern was that we're gonna pass the bill, the Senate's gonna pass the bill, the governor's gonna sign it off, and next Thursday, you'd be driving on the highway talking to your kid on speakerphone because they weren't feeling good, and all of a sudden you get pulled over and ticketed. You say, well, I didn't know that, it was on speakerphone, what is hands-free? What, they had to have that moment for the teachable opportunity, and this is different because you're reaching to a profession, and among professions, professionals speak to themselves. So it's easier, actually, than outreaching to every person that drives in Massachusetts, all 3.5 million of them. But that being said, they want that time for the profession to be able to adjust, to be able to have people who are already licensed to, in the future, if this was some such thing to go forward, to say, well, here's my licensure, here is what I learned, and so have them say, okay, we have an exception, we're not gonna charge you again a second time to go through all this, that's not fair, you seem to be up to snuff and put through. And again, excuse me, I don't see my Tigney's bill particularly addressing that, so again, I don't know if the legislature's gonna push forward on that as quick. And our number one public health concern still is opioid crisis, polysubstance abuse, marginalized populations like veterans returning home with PTSD and mental health at the moment. That's above all. And this, again, not to say that another bill like this could potentially get through, but I don't see how it folds into the priorities that I've seen identified and what the conversations are.
It'll have to be probably at the local level. I'm sure Chief would want to speak with you all about what he's thinking. So.
Oh, yeah, and same with you, any time that any of you have any sort of opinion on any bill, call me.
Well, I'm glad
It's the weekend.
you mentioned the priorities, because as you were talking about that, just to give you an idea of what we're having to do, because the state has opted not to regulate this, and that's the whole body art practice. We're in the midst of updating our body art to cover not only the traditional tattoo, but now the emerging microblading, micropigmentation.
Which I admit I'm a little naive on.
To be honest with you, I really believe the local level is the place to control this stuff. I am a big believer in that you would better be able to regulate and react to local conditions than you would at a statewide level, where it isn't pressing in one portion of the state, it isn't pressing in another portion of the state. You're not gonna have sponsors on these bills going, it's a crisis. But here, we have effect. And I think we have the ability to regulate. We're a board that has the power to regulate. And you know what? I think it should stay here and be regulated here. And I'll tell you, by the time it does get around the table a little bit, maybe the state can take some of these things and look at it and go, that is a good idea from a local perspective. Maybe we can adopt this on some level in the state government.
Well, I think you're right. We have, in a sense, 351 laboratories.
That's correct.
Take a look at
That's
practice.
what happened with tobacco. So
Yep.
that's why.
And to speak to it as well, right? So today, over the last week, we've had 4 hearings on the state level, one for each of my committees. But let's say the most relevant example for the viewers at home was the plastic bag ban. Right, so I'm on the environment committee. We had people out the door waiting for people holding up bags full of bags, guys getting up there saying, I have one that's made from, recycled tires or whatever, what have you, across the board. There are people in there over my dead body. I will be buried in plastic bags before I see you outlaw them. And it opened our eyes, but the most important ones that came forward were actually the municipal officials, because they sat down and they went to, for example, their senior center and realized now, which is one of our biggest concerns, that the reusable bags quite often are too heavy to lift when they're fully packed. And if the kid doesn't take pity on Market Basket and just packs them halfway full, someone with a new hip can't really lift it up to the, and so it's eye-opening. And I think the approach with particularly with not just the body art, but also perhaps the vaping products, was to say, look, we've had 5 of these stores in towns. We had intimate conversations with these owners about their reservations, and here is what we came to an agreement on. And these didn't work, and these did work. And then Barica comes after, and they said, well, we found out these work and these didn't work. And then after a while, you can see a clear pattern emerge of best practices. I think it's funny now that the state's just instituting best practices across municipalities.
Our chicken regulations are a prime example of what we can do.
Yep.
From a local regulatory standpoint.
He's well
It
aware
became
of
a
it.
successful model, and other cities and towns are looking at it and going to adopt it. So we respect you taking that laboratory view, and I do too.
You're the ones in the front line. You're the ones closest to
That's
everybody.
right, and I think we're the most agile and ability to react to
We're much more
local
nimble.
conditions. Yeah, nimble is the
We're,
question.
yeah, we're much more fluid, and I agree with what Bob said, because the way it is, it does take a while for the state to do it and get those best management practices. And on the other side of the coin, we have a group that considers themselves artists, but over the years, they have not collectively helped to enhance their field because of whatever reasons. I mean, I have some ideas why, so I honestly feel that what we do for our local community, we enhance the profession because we want the best of the best. And I think until they get it, I think it's probably better that we enforce it on the local level, because, the state has to have an ability to look at best management practices.
Right. Well, I remember an old friend of all of ours here, Warren Carey, saying, and when Warren was a passionate guy. One night it was dinner with him and Jim, and Warren said it, and I don't know why it stuck with me, but he goes, you can listen to the weatherman, but if the guy in the field says it's raining, you better listen to him. And that's what you are. You're all the guys in the field. You're the ones actually out there. It doesn't matter what they're telling me it is. If you say, Dave, it's raining, you're raining, right? Because you're out there experiencing it on the front line.
I don't want to leave Liz out of the
She's
field,
remarkable.
okay? Because when you mentioned Warren, his field agent is Liz, so I just
Yeah,
want
it's
to give her a one up on that.
Oh, she's remarkable. She's remarkable, and in the same passion and spirit. But I remember him, and I think that's the approach, and I think that's why we see an emergence of young leaders like that here in Tewksbury. Not to pat ourselves on the back, but I think it's still a very communal type atmosphere. It's not interest groups against each other, even though different groups may disagree at times. I think at the end of the day, we all kind of realize we all suffer on the same main street. We all sit in the same traffic on Pleasant Street. Work towards a better place. Wilmington's the same way too. I know I'm back on the safe side of my district now, but I got to say that they have that same sense of approach there. And so whatever you all need,
Thank you.
I'll work with Casey tomorrow. It's Friday. I'll be at work. I can't promise the rest of the state will. But I'll start making calls and seeing what we can do.
Well, thank you very much for coming.
Thanks for coming, yeah, we
Appreciate
really
it.
appreciate it.
Anytime. The selectman brought me down once I told him to bring it back. So if you invite me back in a few weeks for part 2, you will be ahead of the selectman.
You're always welcome.
You're always welcome.
Thank you.
Thank you again.
And come to Tewksbury Cares next time.
Yeah.
Yes.
When we get up.
21.
We're gonna get a little more momentum. We'll bring it.
Getting her home safe.
All right, cool.
Thank you, everybody.
Thank
Thank
you.
you.
Yeah, see you later.
Well,
My brain is going.
Same here.
Any other quick updates for the other board
Happy
members?
birthday to you.
I have nothing further.
you all got my memo earlier. Did you have any questions earlier about the restaurant that had to be revoked?
We can only encourage them to comply with the rules in place for everyone, to try to make it a safe and pleasant environment as possible, and if they can't do it, there are no other choices.
We
I think-
haven't received a request for a hearing yet. I'm off next week, so if it comes in within the 10 days, they'll be contacting you.
Yeah, and I'm out next week, so there'd be,
I think we've been an empathetic board.
Well, if it gets passed on to me, I'll deal with it as I have to.
Yeah, just,
And we try to remediate and work with groups, but sometimes there's recidivism and there's
There's consequences.
oh, yeah. I mean,
always
that's in life,
consequences in life.
in general, right? You eat,
I
that's,
think that's what we've been talking about here all evening,
I
is
think you're right.
consequences and responsibility and
actions.
accountability.
Yep.
Is that kind of like saying being a grown-up for all?
Yeah, it is. Hate being the grown-up all the time.
being a grown-up all the time.
All the
right?
time.
Yeah, no, that's fine.
So you have anything else, Ray?
No, I guess the only thing you had for the announcements was the annual bike rodeo and health fair will be held on Saturday, June 9th, 10 to 1
Is that a
at,
Saturday?
should be, at Tewksbury Memorial High
It
School.
was the Sunday before. Maybe it got changed. I believe that's correct.
Let me just check the date. I think it's a Saturday.
I'll check my,
No, maybe it's the wrong, June 9th. Yeah, June 9th is a Sunday.
I think it was on,
It's,
it
I have it.
was on a Sunday.
Was it on a Sunday? I thought it was scheduled on a Sunday initially.
Other ones have
It's the
been on
9th,
Saturday.
yeah, I have it the 9th.
Yeah, others have been on a Saturday, so.
And the electronics recycling event there is at the St. William's Church on May 25th from 9 AM to 2 PM. I just was contacted by them, I have no affiliation with them, but if you have any electronics you want to recycle on Saturday, May 25th, look at the St. William's Church on 1351 Main Street. So that's, people are always looking for recycling or has waste or things like that, so I was happy to see they were doing that. It was great.
So I had nothing else. Anyone else? Well, someone's gonna have to make the motion to adjourn the meeting since our
Charlie's not here,
Charlie's
Tony.
not here.
I'll make a motion to adjourn our meeting of today.
I'll second that on Charlie's behalf.
Great. So motion's been put forth and second to adjourn tonight's meeting. All those in favor signify by saying aye.
Aye.
Any abstention?
Spiritually.
Motion carries 4-0. Good night, Tewksbury.
Good night, Tewksbury.